Well, good morning, everyone. And how are you? How you doing? Welcome to another live this morning. The doctor is in, podcast, and live Facebook. We appreciate you guys big time. Where would we be without our audience? Brahim, where would I be without you? Mike from Norland. And Andrea, Niagara Falls. And the Trinity. And Janice right up at the top. Lynn from Aurora. You guys know how to get on early. Amber from New Jersey. Rosalinda, Niagara Falls. Sandy, Fergus Falls, Minnesota. Nativity, good morning to you. And Marlene, nice to have you on. Jude from Troy, New York. It's like I know you guys. Marilyn, PEI. Brahim saying it's really warm out in Portland, Oregon. Lise, how are you? Nick from our staff. Wendy from Markham. Sherry from Mississauga. Moses, California, how are you? Wendy, Wasaga. Fran from Orangeville. Hi, Fran. Bruno, Laurie, Cambridge. And Karen, Innisfil. Donna from Newfoundland. How are you, Donna? Norma, Texas. Frida, good morning. Kristen, Saskatchewan. Kevin was in the clouds today. And Cheryl, Martin River. Laurie, Alberta. Danny, good morning. Happy Q&A, he says. Yeah, you're right. Helga, good morning. Suzanne from Edmonton. Crystal, Regina. Maria, Portugal. Francis Marie, good morning. Denise, Oakville. And Rosa is saying hi to Kevin. Francis from Vaughan, how are you? Millica from Stouffville. Nativity, good morning. Teresa, Dunedin, Florida. Bonnie, Little Britain. Sylvette, how are you? Bonjour. Francis from Montreal. Carol, up in the clouds. Wendy from Aylmer. Amina, how are you, Amina? Nice to have you on. Thank you for coming. Donna, saying hello to, who were you saying hello to? Diane, how are you from Thunder Bay? Lisa, couple of more guys. Judy, we got lots of questions. Hi, Keith, how are you? Patricia's in Sudbury. My word, where's Sudbury? Sylvie, Sault Ste. Marie. Fran, hi, Doc. How are you, Arlene? Brenda from Bancroft, how are you? Thanks for coming on, guys. Nativity saying hello to Maria. Karen, Maple Ridge. And Wanda from Virginia. Renee, how are you? Cecilia. Shediac, Nouveau Brunswick. Dave from Muskoka. Shelley from Sherwood Park, Alberta. And Lorraine from BC. And Cheryl. Good morning. I'm going to say hello to Doc McEwen. She's usually on. I never see her name, or rarely. Okay, Donna, Rita, Lise, how are you? Okay, let's get to our questions. This comes to you from, the first one I'm looking at this morning, Angie. Okay, hi Angie, how are you? Let's see, I think you asked this question twice. Okay, what would Dr. Martin recommend testing the biomarkers of fibrinogen and homocysteine? Okay. And Angie recently went to the hospital, had this tested. Homocysteine was high, and so was her fibrinogen. Okay. So let's talk about that a little bit, Angie, okay? When they do fibrinogen, what they're doing is checking out clotting factors. And they're looking to make sure your blood's not so thick that it could easily clot and they do that test for a couple of reasons, fibrinogen. One of them is making sure you don't have blood clots, especially in your lungs, coming usually from the legs. They'll test that. It's fibrinogen. If it's high, they're suspicious. Okay? The other reason that fibrinogen is checked is for carcinoma, especially like pancreas, pancreatitis, gastric carcinomas, okay, cancers. They check that. They use, it's not the only test they do, obviously, but fibrinogen is something, you got to rule out those things. You went to the hospital, they probably ruled all that stuff out, I would think, Angie. Secondly, you talked about homocysteine, okay? Now, what is it? Let's talk about homocysteine just for a minute. You know that I wrote in my book, Sun, Steak, and Steel, okay? So just get it out here before I knock all my books off my shelf. I'll get it out. Okay, hold on. See that? Sun, Steak, and Steel. Oh, it drives me crazy when I'm on my bookshelf and I'm knocking everything. Okay, so in Sun, Steak, and Steel, I talk about homocysteine, okay? And that is it's a test that, unfortunately, a lot of doctors, there it is, see, just fell off. A lot of doctors don't do this test when they should. My word, okay, stop. That was my bookshelf. Okay. Okay, so homocysteine, okay? Why it's dangerous, okay? Because, okay, homocysteine is a measurement, okay, of the clearing of amino acids, okay? I don't want to get into the weeds. I just want you to understand what I'm talking about. When they test that, okay, think of homocysteine, think of your fireplace. Let's say you got a fireplace. And the smoke ought to go up the chimney, right? But what if the chimney is blocked? Smoke comes back down. That's really what's happening in homocysteine when it's high. It damages your blood vessels, especially the smooth muscle. Yesterday we talked about, oh, I hate to touch my bookshelf again, but I'm going to do it. Okay? Because we talked about this yesterday. I'll show you a picture of it again. Okay, for those who are watching live, okay? See the blood vessels, okay? I got out my atlas. See the blood vessels? Right at the lining, we talked yesterday about nitric oxide and its importance, okay? Well, homocysteine, when it is high, it's damaging the little lining of your blood vessels. Makes you more susceptible for clotting. Makes you more susceptible for heart attack and stroke. And you can measure it. It's called homocysteine. Okay? And it's not supposed to be high. Now, okay? What lowers homocysteine? How can you lower it? The biggest thing in lowering homocysteine is B12. So when you're low in B12, your homocysteine can go up, okay? Your homocysteine can go up. B12 helps to lower. That's why, again, I talk about what are my two favorite vitamins? Well, 3, 4. I got lots of favorite vitamins. But you guys know me. What are my favorite vitamins? Vitamin S, steak. Steak will lower your homocysteine. Why? Because it contains B12. You eat steak, your homocysteine goes down. You take B12 as a supplement, methylcobalamin, homocysteine goes down. Okay? And I like, you know me, vitamin C, coffee, the real vitamin C, vitamin D, the sun. Okay. So you guys know all that. I'm just repeating. Okay? That's Angie. Thanks for the question. Celia. Hi, Celia. Have you ever received, if you have ever received a vaccine of any kind, okay? Does it ever leave your body? Well, vaccines by nature, okay, Celia? It's a good question. Vaccines by nature are made not to leave your body, okay? A vaccine, okay, let's say, I always used to like the word in school, Bordetella pertussis, okay? You know what Bordetella pertussis is? I used to, when I was in high school, I took Latin. I hated Latin, okay? I hated it. And medicine is Latin. I don't hate medicine, but I hate the big words they give. You got Bordetella pertussis. What is that? The whooping cough. Okay. So when they give you a vaccine with Bordetella pertussis for the whooping cough, they're actually giving you a little bit of the whooping cough with the idea that in that vaccine, your body is going to flag Bordetella pertussis. And your immune system is going to flag it and say, I am now building immunity for Bordetella pertussis. Okay? Do you understand? That's what vaccines do. Okay? They're meant to stay in your body. They're meant to sort of give you a code to protect your body from, the measles. You know all the vaccines that they give, right? They give a flu shot every year. That's a vaccine, except they always get it wrong. They always say, we think this is what it's going to be this year, and they get it wrong 90% of the time. Okay? I'm not going to go into, guys, vaccines to the extent I could. Okay? The pros and cons of them. You know me. I am huge on you building your immune system. Do you want to talk about me? That's what I do. Build the immune system. Okay? Now, let me see here. Let's get to another question. My book. I'm still thinking my bookshelf. Okay, Lois. That was Celia asking the question about vaccine. Good, very good question. I want you guys thinking. I appreciate it. Lois. My mother's name was Lois. Lois? Okay. What, if anything, can I do to try and heal from adrenal burnout? Okay? Look, I wrote a book about it. Okay, let me get my book without trying to destroy my bookshelf again. I'm going to show you a book I wrote. Well, I wrote several books on it. I show you the one in French. Where's my other one? Okay, it's here somewhere. There it is. Okay. See, you recognize that guy there? Oh, French. Okay, I wrote a book on adrenal burnout. I think, I've said this for a long time, but I think I'm right. I was the first guy that said about chronic fatigue syndrome, the actual syndrome of chronic fatigue, which was characterized by severe fatigue okay? Severe brain fog, fibromyalgia symptoms. You know, I know they separate fibromyalgia from chronic fatigue, but I believe they are two sides of the same coin. I'm convinced of it, okay? Fibromyalgia and chronic fatigue, I put them together. Two sides of the same coin. So, and sleep disorder, exhausted but don't sleep properly, don't get that recuperative sleep. Those are the main symptoms. Debilitating fatigue. There was an epidemic of it back in the late 80s. I did my thesis on it. Okay? So, I mean, I studied it inside out. I studied that. My wife had it. Okay? And adrenals. Okay? When you think adrenals, what do you think? You think cortisol. Okay? Cortisol. And cortisol is important. You need it. And it should follow what we call your circadian rhythm, meaning that your cortisol is higher in the morning and then goes down gradually during the day to very low levels at night, if it's right. But what you're saying, Lois, is that yours is always low. Your cortisol is low. Yeah. Well, your adrenals are exhausted. I used to tell my patients, your battery packs have absolutely no charge left. You know what I mean? And so I developed a protocol, okay, Lois? I developed a protocol over the years. If you look on our website and go to teaching on hormonal storm, you're at category 5. When your adrenals are exhausted, you're category 5. And there's a lot of factors in it. The thing that I would suggest to you the most, Lois, is start with food. I can tell you when your adrenal glands are exhausted, you and carbs, you're going to crave carbs. Because your body wants a quick fix. Give me something fast. Give me something quick. I used to get my patients on the reset. Give your body the best fuel. Eggs, meat, and cheese. Even when your blood sugar is going up, your blood sugar is going down, your blood sugar is going up, your blood sugar is going down. That's part of adrenal gland exhaustion. You want a quick fix. And don't give yourself the quick fix because you're just making it worse. It's not easy. This protocol is not easy because you're exhausted. If I was to check, and I almost guarantee it, Lois, if I was to check all of your biomarkers that I used to do biomarker testing in my office, okay? If I was to test all that, yeah, your cortisol would be low, but your cortisol's out of whack, okay? 1. 2, your thyroid has slowed to a crawl. Your B12 ordinarily is very low. It may be normal, but it's in that low end. Your vitamin D levels, low. Your inflammation markers, high. And if you want, send an email into info@Martin Clinic. Give me all your numbers. And let me look at them. Okay? I don't do it so much. I don't do it forever. Could you imagine? We got almost 89,000 I think we do have 89,000 followers on Facebook. I just can't answer everything, okay? But if you put it out there, those numbers are not good. But just generally, but start with food, look at your level. And one of the ways, by the way, I discovered pine bark extract, you should be on that without exception. The best thing for adrenal gland exhaustion, we have a cortisol formula, yes, for sure, to be on it. Whether your cortisol is too low or whether your cortisol is too high, it doesn't matter, it's a balancer. But Navitol, pine bark, it is the one supplement that I discovered years and years ago, to go back 35 years ago, that really helps with adrenal gland exhaustion. I think I was the first guy, Lois, okay, because people thought it was the yuppie flu. They thought it was a virus. They thought it was, but if you have adrenal gland exhaustion, yeah, no fun under the sun. Okay, that was Lois. Tina's asking, why do platelets tend to drop during pregnancy? Well, I think it's just your blood, your body has an enormous ability, Tina. Think of the protection your body gets when you're pregnant. Okay? Fearfully and wonderfully made. Things change. You don't want any clotting to happen. And that can happen during pregnancy. And it's one of the reasons your platelets would go down. Platelets are sticky. They stick. They make sure you don't bleed and lose, you know what I mean? Lose blood. So, yeah, it's one of the reasons that during pregnancy that the tendency for platelets is to go down. Very normal. UWE. I hope I pronounced that right. What is Dr. Martin's thoughts on Plexus Slim? You know what? I'd have to Google it. Because what is it? The only thing I'm telling you, when you see Slim at the end, I'm not telling you to run, Forrest, run, but if it's telling you, you just take this supplement and you're going to lose weight rapidly, run, Forrest, run. Okay? There's no magic. Now, you have all these GLP-1 medications that are injections. Wegovy, you name it, coming on the scene now. And what do I think of those meds? Not much. Designer drugs. And quick fixes. Yeah, with a boatload of side effects. Guys, you gotta eat anyways. True or false? Yeah, gotta eat. Well, then eat the right foods. I'm a fuel guy. Eat the right fuel. Pretend you're a wood stove. Better to run a wood stove with paper and twigs? A fireplace? Nah. You want to heat your home? Better paper and twigs? Nah. Logs. Eggs. Complete nutrition. Meat. Complete nutrition. Good dairy, butter, cheese, cream. You got a cow in the backyard, whole milk. Complete nutrition. That's what the best thing is for you. Okay? That's what the best thing for you is. And I don't know about this product you're talking about. There's a lot of talk on berberine. our insulin balance, if we can ever get it back. Oh, I get a migraine. They help regulate blood sugar, but again, you can't out supplement a bad diet. You can't do it. I'm a food guy. Start with food. Okay, thank you. Francis, can you explain how a 3-week-old baby can get a urinary tract infection? Well, there's a couple of ways. Okay? There's a couple of ways. Mommy, it happens, is on an antibiotic. Baby, even in the placenta, gets affected by that. Baby not coming through the birth canal. A C-section, for example. Not getting the bacteria that they need, the friendly bacteria. I mean, there's things like that happen. And a 3-week-old baby, they'll probably put the baby on an antibiotic. Ooh. But I hope mommy's breastfeeding and mommy's taking probiotics. She can put a little bit of probiotic right on her nipple. Okay? And would be good for baby. Those are usually what happens. Francis. Charlene. My CT scan showed I have thyroid nodules. You and millions of others, Charlene. You and millions of other people have nodules on their thyroid. Okay? And ankylosing spondylitis, which is an autoimmune disease which affects the spine. And you get what they call a bamboo-like spine. Okay? I used to see it on x-rays. Ankylosing spondylitis. I always used to say this, okay? You got ankylosing spondylitis, it started with leaky gut. Any autoimmune started with leaky gut. Leaky gut, leaky spine. There's a connection, okay, between leaky gut and ankylosing spondylitis. Now, what were you asking me? What do you think of the nodules? Well, usually when I saw thyroid nodules, the thyroid was not up to snuff. Now, there could be a lot of reasons for that. Okay, we just talked earlier about adrenal glands. When your cortisol is too high, it robs your progesterone. When you rob progesterone, that affects the thyroid. Estrogen goes up. Estrogen dominance. You're not converting T4 to T3 properly. The thyroid slows to a crawl, often with nodules. And remember, okay, there's 2 growth hormones. Insulin will make your nodules grow. And estrogen, too much of a woman, even in men, grow. Get estrogen down, flax seeds, dim it out. Our menopausal formula has DIM, D-I-M, dim out the estrogen. The bad estrogen, you need estrogen, you're a woman. Don't worry about estrogen in a lot of ways, you got lots of it. Too much. That slows the thyroid to a crawl. Men, your prostate, how do you think it grows? Insulin and estrogen. Okay. And let me just see here. And my hair is thin. Yeah, your thyroid is sluggish still, Charlene. Okay? Make sure, you might be finding that your cortisol is very high too. Yusuf, how long does it take to see a difference with omega-3 on blood work once you start taking it? Well, it depends. It depends. What kind of omega-3 you're taking. Like you can measure omega-3, which is a beautiful thing. I like it. Okay? But it depends. Everybody's different in that sense. Like if you're taking a real good omega-3, if you're taking high DHA, I usually notice a difference in blood work within a month of taking it, Yusuf. Okay? If you take a high quality omega-3, and guys, you know me, I talk about this all the time. The best omega-3, there's a lot of cars on the road. Okay? There's a lot of cars on the road. But if you want a Maserati, you got to take the high DHA. Look at your labels. Because omega-3, there's lots of it. There's a lot of companies. There's a lot of, look, I love omega-3. I love when you eat omega-3. When you eat a steak, omega-3. Especially the grass-fed. You have fish, omega-3. Right? Even omega-3 is in the plant kingdom. You got omega-3. But the best are the long-chain fatty acids. The longer that chain of fatty acid, omega-3, the more bioavailable it is. The more you absorb it. Okay? Got it? Okay. Thank you, Yusuf. Danny. What advice would you give me in regard to sun allergy I developed over the last 2 summers? Yeah, I feel sorry for you, Danny. So cover up. Okay? A lot of people with lupus they can't get in the sun, but they still got to take vitamin D. Take it as a supplement. And remember, even if you're not going to go in suntan, Danny, even when it's sunny out, like it's sunny out here this morning, okay? Not bright sun, but it's still sunny out. And if I look outside, I'm getting melatonin. Because just the presence of the sun, and you look and your eyeballs take in, and in the third eye, your pineal gland, you're accumulating and producing melatonin. Like people think of melatonin as a supplement. Yeah, I don't even like it as a supplement. Okay? I'm not big on melatonin as a supplement. I'm big on melatonin. Your body produces it. The sun. So, Danny, if you have an allergy to the sun, 1, I feel sorry for you. 2, you still need the sun. But you can't just go and suntan. You've got an allergy. And usually, Danny, you got leaky gut too. Usually, you're messed up there, leaky gut. That doesn't mean you're getting digestive symptoms, but there's a leaky gut. Maybe fungal. In my practice days, I would have figured you out. Okay, let me just see here. Okay, that was Danny. Thank you very, very much. And by the way, any kind of allergy, get on quercetin, Navital. I love that combination. Laura, is Gaviscon considered a PPI? I don't know if it's considered exactly, but Gaviscon sort of coats your stomach. Okay? I look at it as like a paint over top of acid. I don't like anything that decreases your stomach acidity is not something you really want. And they were never meant to be long-term uses, including Gaviscon, okay? PPIs, they turn off your proton pumps. You don't want that. You want to be more acidic, not less. Okay? Now, let me read your question. Okay. Are there better cuts of meat to buy? Yeah, of course there is, right? There's good. All meats are good. Better. Okay. Better cuts. Okay. and best steak. I'd put liver up there, but I don't like liver. I know it's good for you, but I don't like it. Okay? But I love steak. There's nothing better than a steak. It's the best. It's better than fish. But fish is good. Okay? Good, better, best. Okay? So, yeah. Okay, that was the question. Ground beef, better than chuck. What is the best cut to get for red meat? Okay. Laura, better than chuck. Ground beef. Yeah, I'd say probably, again, look at that scale. Okay. But all beef is good. All of it. And the fat. When you get ground beef, I know they take the fat out of it. I want to, scream. I love butchers, but they've been butchered. Because butchers, they're being told, take the fat out of it. Looking for lean ground beef. Why do you want lean ground beef? It's good, but it's not the best. Okay? Fat don't make you fat. Fat don't give you cholesterol. Well, it don't give you heart attacks. Yes, it will give you cholesterol. Okay. Okay. Deborah, I bought Nature's Bounty. Okay. What do you want to know? Okay. I'm trying to answer your question, Debbie. I got to read it. The label reads cholecalciferol, that's vitamin D3, and menaquinone, that's your K2. Okay? Is it good? Yeah, it's good. I'm biased, okay? You're asking me, Deb, and I'm biased. Yeah, look, there's good, better, and best in supplements too, okay? And the reason the Martin Clinic makes its own supplements is because I was in practice and I wanted the best. And my son, who is a biologist and smarter than his dad, we're formulators, okay? And so, no, I like it, Angie. You're all right. You're good, okay? It's not the best, though. I'm very, very biased. No, you got a good product. Okay, Debbie, Susan, can specific drugs cause gout? My friend has never had this before and came out of the blue. Well, gout often does come out of the blue. Okay? Specific medications, like gout is more complicated than that. Okay? Obviously high uric acid levels, okay? But a lot of people with high uric acid levels don't get gout. But uric acid is more of a biomarker. We like it. I write about it in my book again, Sun, Steak, and Steel. The measurement of uric acid, because I have put it in the category of metabolic syndrome. I look at your HDL, I look at your triglycerides. I'm very interested in that, much more than the other cholesterol numbers. I want to know your HDL, I want to know your lipids, your triglycerides. I want to know your A1C. I'm very, very big on that, okay? Never to be over 5.4. And, belly fat. And vitamin D, I put that in there. I put B12. Biomarkers, okay? And can specific meds cause gout? Can they cause a flare-up? Maybe. I got to think about it, okay? I got to think about it. But gout often comes out of nowhere. People, and they think they hurt themselves, or they, what is this? Okay. And it's very, very, very painful for gouty arthritis. But the biggest cause of gouty arthritis today, the biggest cause is insulin resistance. And, why has gout gone up 300%? We called it the king's disease, drinking too much wine, not eating red meat. People, I eat too much red meat. It's insulin. It's insulin resistance, plus the fact that you're consuming high fructose corn syrup, usually. High fructose corn syrup goes directly to the liver, and if you can't flush out the byproduct of that, which is uric acid, they will accumulate. Your kidneys are under stress, and you can't get rid of all that uric acid, and guess what? It can crystallize and form gout. And the crystals, yikes, when they get inflamed. Okay, let me end this here again. Let me just see how many we got to go. Okay, you know what? I got to do another session. Got to do another session. Yeah. I'm trying to read some of the stuff here. I love beets, Thomas. I'll answer that. Let's do a Q&A Monday, and I'll probably have maybe a little bit of I got some great studies on probiotics, brand new ones that just came out. We'll comment on that next week for sure. Okay, guys. Thanks for sending in all your questions. You guys are incredible. We love you dearly and sincerely. Have a great weekend.